Welcome, you guys, to Nothing But the Truth. I am your host, Sherry Ryan, and today I am talking to Jessa Reinhardt. She is with an organization called Oregon Advocates for Equitable Disability Services, and she's a resident of Vernonia, Oregon, here in Columbia County. Welcome, Jessa.
Hello, nice to be here.
Yes, I'm so glad you're here. Um, so can you just tell us a little bit about the organization and about that?
Yeah. So Oregon Advocates for Equitable Disability Services is a coalition of parents and organizations and self-advocates who are trying to make permanent a temporary rule that has allowed parents to be their paid caregivers to their disabled children.
Great. Can you tell us a little bit about you and your situation, how you got involved in this effort?
Yeah, so I'm a mother to three children. My oldest is autistic and she has additional disabilities on top of that. Because of that, she receives developmental disability services from Columbia County, which includes attendant care hours, which is caregiver, and additional services on top of that.
Okay. The DD program, right? The Developmental Disability Program.
Yes.
Okay, and for children. And so that brings about where you can employ caregivers, right? And so
Yes.
can you tell us a little bit about that, about like your decision about employing caregivers and other parents?
Yes. So Developmental Disability Services, they do a very thorough evaluation to determine the needs of the child. And that equates to what they call attendant care hours or personal support worker hours. And each child is designated a different amount based on their needs. My child's been in this program for about 4 years now, but we've never employed a caregiver for our home. There's a couple of reasons because of that. The main one being that our home's always been a safe space for our child and all of our children. We didn't really want people coming in and out of our home. We wanted to really make this a secure place where our children can always be themselves without having to worry about, how they were acting or what they were doing. My daughter has a lot of anxiety, so she doesn't do well with new people coming in.
Yeah.
We also live, in Vernonia, so it's a very rural. Trying to hire caregivers can be pretty difficult, especially when it's left up to the parents to recruit, interview, train, and retain caregivers. That's
Yeah.
parents. It's not something that Developmental Disability Services provides. So it's always been kind of something that was not going to be good for our family. I do know that other families have tried to employ caregivers and have been met with high turnover and unable to find anybody. There has been some cases of neglect that has happened with hiring out caregivers, and other people have had success.
Yeah.
Say caregivers. They've been able to employ grandparents, aunts and uncles of the children so that they've already established relationship and that's worked really well for them. But that's kind of how that happened and just not something that worked out well for us.
Yeah. And so, this is the way that the DD program works, and is that there's been, the employees have been other people, like you said, grandparents or different people that you guys have had to, find and train and such. And so then this really interesting thing happened. And this was a temporary waiver that was put in place, that came into place. Can you tell us a little bit about how that happened and why it happened?
Yeah. So as we all know, COVID came into our lives. And with that came the federal public health emergency, which did a whole lot of things, especially in regards to Medicaid and various services like being able to have remote doctor's appointments. That's one thing that was put on through the temporary emergency. In addition, the federal Medicaid authority allowed states to choose to allow parents to fulfill the caregiving hours of their minor children, which has not been allowed before. For children who become adults who are 18 and over, their parents have always been able to fulfill those care hours and work those hours, but that's never been allowed in Oregon before. So Oregon, along with the majority of all of the states, signed up for this temporary waiver. So that way we could limit the amount of transmission of COVID, because we're talking about severe high needs children here, severe high medical needs, who would get very, very ill if they were sick. And also because there's been a huge caregiver shortage. People were not wanting to work, so there wasn't caregivers available. But this program was only allowed for the very high needs children. So there's about 4,000 children who get disability services in Oregon, and only 700 of those fit the criteria for this temporary program.
Okay. Because of the high medical needs and such. And,
Yes,
like you said, that, like they would come in and, if they were to get COVID, it could be very, very dangerous. And okay, so they put that in place. And so now that emergency, temporary waiver is going to be going away, right? That's going to be ending. What are like your points? I love to hear, like, as an advocate, what are your top points that are showing, you and other parents, have for wanting to keep this waiver in a permanent place?
So those 700 eligible children either have high medical or high behavioral support needs, but we're talking about they need 8 hours of care or more a day, in addition to what a typical child would need. So these are very, very, very high needs children. And so what we are trying to do is we are trying to make this policy permanent, but include all of the children who receive developmental disability services, which are that 4,000.
Okay.
Which actually only represents 0.6% of the whole entire state of Oregon's children. So we're talking about a very, very small percentage of children here, but they're its most disabled children. Because what we found with this program is that the children have been stabilized. Their homes have been stabilized. We were able to capture 100 families that are in this program. And we found out that the children's health has improved, their mental health improved, there's less hospitalizations. The parents' health and mental health improved. The parents felt valued. These are parents who have been unable to work for probably the majority of their child's life, and for the first time able to receive a paycheck for the work that they've been doing. So it's completely, stabilized these families are, the ones who are most disabled, who are most in need of care, in ways that we have never seen before. In addition to that, we have seen access to the community improve. One, it's kind of an off benefit. It's not what the program is designed to do, but an extra benefit to the program is that families have been getting an income. And so that the majority of these families have only had one income because of the needs of the children. And having that extra income has allowed people to buy wheelchairs that they've been able to afford. So their children can be out in the community, afford classes for these kids. We've been able to go to the zoo, which we haven't been able to do before either. So it's just really opened the world. The world that every other child gets to have, that these children have, kind of really blocked out of because of they don't have care and the families don't have income, and we're just kind of been pushed down for so long. And now, there's the whole world's opening up for all of them.
And other states do this, right?
Yes. So there's been some states who have done this for a very long time. California is one of them. After this temporary waiver came in place, a lot of other states have been champions in saying, we need to make this permanent. And so they've they've been able to do that, and each state is able to make this look different for them. They can pick and choose from Medicaid what their services look like. The majority of them strictly focus on high medical needs children, or they limit the amount of hours the parent can fulfill the work for. But what we're trying to do is we're trying to make Oregon the best. We really want to see that, Oregon is at the top of being able to allow access of these hours to be fulfilled by parents, for high medical needs, high behavioral needs, and everybody in between. Because if they're, not the tip top of being disabled, they're still disabled and they still need support and they still need care. And there's really no reason not to support these children with the hours that are allotted.
Yeah. What has been the pushback on this? So you guys, you're saying like you have to advocate for this. You've created a whole group to have to advocate for this, because what is the pushback? What is the pushback on this process of making it permanent?
So our Facebook group has 550 members who are advocating to make this permanent. And we're having to advocate very, very hard. We're getting some pushback. The majority of it, though, seems to be related to budgets. So the Oregon Developmental Disabilities is the one saying that, which is funny because these children are determined to need specific amount of support, and the state is the one who gives it to them. So when we hear that there's a budget issue, that means that the state is okay with these children not receiving the support that they have been determined to need and qualify for. I reviewed the data from 2018, so this is before the pandemic, 2018, and we looked at the amount of care hours allotted to the child and the amount of care hours used, and we determined that only 59% of those hours were actually utilized. So 41% was left unmet, and that's support for these very disabled children. And what we're offering is to fulfill that need, so these children are fully supported, but the state is telling us that that's a fiscal issue. And that's really the main and only deterrent right now, that the Developmental Disabilities Services Office is saying that we need legislative authority to then make this permanent.
Okay. So can you tell us a little bit about like what the Oregon Advocates for Equitable Disability Services has done, what you guys have done, and then like what you guys are planning on doing to advocate for this waiver to be permanent?
Yeah, we've got about 15 members in our leadership group, and they're all wonderful. I mean, definitely putting in more than 40 hours a week into this advocacy. We started with emails out to legislators and organizations trying to back this. We've met with Oregon Developmental Disabilities Services as well. We have slowly been gaining more momentum and meeting with legislators. It started with like one a week. We would get a legislator to speak with us, and we'd get very excited about that. And now it's grown to where last week we were invited to give testimony at different House and Senate committee hearings as they're deciding what bills they're going to push forward for next year. And we're meeting with legislators about 1 to 3 times a day. We've gotten some big organizations as well to support us in this initiative. And so what we're trying to do now is gain as much support in legislature as possible. Both Democrats and Republicans are backing this initiative. They see the value in really supporting these children, but we're still not finished yet. So our next step is to continue to meet with legislators and get a team who will introduce a bill in the next legislative session. And this bill will make permanent this temporary policy. We're hoping that they see and understand the need for it for all of the children who receive disability services. And then also in the meantime, we've got these 700 families who currently qualify, who, when the PHE ends, will be cut off of this program. And the PHE will most likely end before a bill can be written and implemented next session. So we're hoping for some emergency funding to help stabilize the families currently on the program until legislation can be finalized. And so we're just, going hard and really, working as hard as we can with meeting with, any organization who wants to meet with us or any legislator who wants to meet with us. We've gotten Betsy Johnson is, I think, our highest one to support the cause. And, we're just really trying to get it out there that this is a program that is really going to stabilize these children. It's needed. These children, deserve and need stable caregivers. And it's not something that they're currently receiving. And we want the best for Oregon, and we want the best for these children.
Wow. Thank you so much, Jessa, for taking the time to give us all that insight and that info. And I'm going to post your guys' contact info after this, and so that people can reach out to you if they would like to, be involved or need this and such. So thank you so much, Jessa, and we'll talk soon, okay?
All right, thank you.
Thank you. Bye-bye.
Bye.